Welcome back to our channel for the third video. Sorry for we have the lacking of uploading. I have been studying for my exams coming up in this month and next month. I am going to try to make some time. Mommy has the time, well, not all the time, but she has the time.
I do.
I'm gonna try to make the time.
He's very busy.
Yes. So, today we're going to be talking about
Knots in the muscle, especially in the neck pain,
head pain as well.
and headache that comes from
Tension headaches.
Tension
When you have pain. For the past 1.5 months, every day, or not every day, but every other day when I go to school, I have these headaches and I get these lumps in my head. Right here.
knots in the muscle.
Not yes. My mom says they're called tension headaches. Please explain to me how they work. I just don't know.
Okay, so yes, children when they go through exams, especially exams that will take you from one school to the next, from prep school to high school, they get a little bit of tension, and the muscles around the neck, they're there to help the neck to turn, and especially when you're studying a lot, you're in one position for a long time. You study a lot sometimes in one
Yes,
position?
I do. Yes.
Yes.
Sometimes I'd be sitting up in my desk upstairs studying man talks.
Yes.
Man talks tests.
So there's something that we should do for children. You should never allow your children to sit for more than 15 minutes to half an hour without even having them move around a little bit, because motion is motion, right, Michael?
Well, I have to object to that because many parents in modern days, not Jamaica, that's fine, but I'm moving over to European and American sides.
Yes.
Children basically sit at their computers and phones half the day.
And that's not good, which is why we're having a new, especially in my practice, most skeletal practice, I'm seeing a lot of younger people, thank you for bringing that up, with neck pain and back pain because they're not moving. When I was young, we used to always be outside playing physically, but now people are playing on the computer, and so we need to establish stretch breaks. So Google stretch break, you should always try to have your children take a break every 10 to 15 minutes.
10? What?
Well, okay, fine. I'm just
Well,
saying.
that's not fair. 30 minutes is like...
Right. Well, even if you're not getting up, have them move around. But to be like this for a long time, it's going to put a lot of pressure on the muscles. And so we're going to talk about something called trigger point. And what is trigger point? Trigger points are these little knots in the muscle. Can you feel any knots in your muscle?
Right here.
Yes, he has a knot here. You even get some in your calves sometimes. All the time, right? And so these knots are the muscle fibers that are more or less entangled. You know what entangled means?
Yes.
Tell me.
When they're tangled up together.
They're
Tied up
together. And when the muscles are sustained in contraction, it uses a lot of energy. And when you use energy, what happens?
You get tired.
Touch me.
Okay.
Yes, the muscles get tired. And so you have an energy crisis. So when the muscles get tired, have you ever been running and get tired and your muscles start burning and aching?
Yes.
That's muscle fatigue. So essentially you get these energy crises in the muscle, so the muscle becomes ischemic. You know what ischemic is?
Not a clue.
It runs out of blood. So the blood
What?
vessels are, in a sense.
You can run out of blood?
No, you can't run out of blood. So let me rephrase that. So when the muscles become ischemic, the muscles have so much tension in it that it kind of occludes or blocks the blood vessels. The blood vessels decrease the flow to the muscles, and the muscles kind of burn. They run out of oxygen, and they hurt. Do you understand? And so we need different treatment. So you get something called myofascial pain. Myofascial pain. And so the thing with myofascial pain is to remove the underlying cause. So there are different causes of myofascial pain. Can you think of one? That's the microwave. We'll leave this in the video. The microwave just went off. Myofascial pain. Things that cause myofascial pain. Things that cause muscle ache.
If you're exercising for too long. Run up and down, you run down, you never stop.
Overuse.
Let me give an example.
Overuse.
Let me give an example. I and my mother ran around this community many times. I'll send a snapshot of how big this community is without stopping. And it is crazy. And we don't do just one lap and then turn around and then stop. Oh, splinter. We don't do one lap and just turn around. We literally go for like 3-4 laps and then come back inside without stopping. My muscles burn like crazy.
Yes, so good. So that is kind of essentially exactly what it is. So myofascial pain, Michael, can come from overuse. I love the fact that you say that. Incorrect use, like poor posture, ergonomic, weak muscles, and something wrong with the spine, like you have a disc problem or something in the
when you lift your back and you lift your back instead of your legs, ergonomics. And I was very confused, I remember.
Very good. You can also get knots in your lower back from ergonomics, as well, lack of poor ergonomics. And so essentially, what do you do with myofascial pain? 1, remove the underlying. You need to stretch. Stretch. Motion is motion. Stretch your neck.
Yes, I did.
Let's stretch your neck. Left? Well, that's right. Let's go right. Look at me. Turn to the left. That's tilted, Michael. Okay, watch me. Turn to your right.
Oh, that's what you mean.
That's turn. Turn to your left.
Look how far.
Good. Turn to the right. Straight ahead. Look up. Look down. Straight ahead. Tilt to your right.
This is an R stretching session.
I know.
It's their stretching session.
Oh yes, but you can't
follow the instructions in this.
No. Get your doctor's clearance before you stretch. A disclaimer.
You're their doctor.
I am not their doctor yet. They need to be examined. And so whenever you're giving out the instructions, you always have to be careful for the patient that might have a problem that your stretch can cause further problems. So you have to do a disclaimer. Make sure you get medical clearance before you do any of these stretches. Yes. And so after you do your stretching, you have to strengthen the neck. How do you strengthen your neck muscles? I can show you. You want to learn?
Yes, I do. I did. Yeah.
Okay, so here we're gonna go. So the neck muscles are right around. So essentially, if you want to strengthen the muscles to turn right, and resist. Muscles to turn left, but resist. Muscles looking back, going back, go back, but resist it. Perfect, 2 hands. Actually, that's correct. Muscles going forward, go forward. Exactly. And muscles tilting to the side, tilt. Hold, you have to resist it. And resist the other side. So the range of motion is what we first did. Retract the neck. Go back.
I still have a question.
I want to get it.
Remember when I asked why do I get these headaches? I still didn't get it answered.
Good point.
And I'm getting a headache right now.
Speak up louder.
I'm getting a headache right now from it.
Right, because the headache, the muscles creates a tight band around the head, and it affects the blood flow. And you see just how you get the pain in the muscles. You get pain in the muscles around the head, and pain in the muscle around the head can give you a headache. It feels like a band around your neck. All right, so Michael, what are you doing?
Yes.
All right, you want to close out this video because
no, I'm fine.
I don't know what's happening.
I'm fine.
Okay, so 1, did I answer your question about
yes,
tension headaches? 2, did I teach you how to stop that, please? Do range of motion?
Yes. How does the when you said the tension around the bend of your head, what does that tension come from? The knots?
The muscles in spasm. So you have muscles.
How do the muscles become spasmized?
Because they fatigue.
That's a word.
I like that question, because they fatigue. So the muscles go into spasm because you're keeping them in this sustained position for long, and then they get fatigued and then they can't hold anymore, so they spasm. And then because you don't necessarily exercise and you don't have the full range, they shorten and then they tighten.
So you're saying that the reason I get headaches at school is because I am in this position for 3 hours straight doing work.
That may be one of the causes, but another cause of headache is anxiety and mental pressure.
That makes sense.
And in fact, I'm going to use a big word called convergence. What is convergence? So you have pain fibers called nociceptors that carry pain, and then you have fibers that carry sensation like light touch and mechanoreceptors, which is movement. And when you have a lot of myofascial knots in the muscles, the pain fibers kind of get converged and mixed up with the light touch fibers or the movement fibers, and you get pain. It's called upregulation, peripheral sensitization.
Oh my.
Or mechanosensitization. It's a pain medicine thing. But to make it simple, when you have pain for a long time, the pain can come from movement or light touch, and symptoms or signs, things that you do that don't normally cause pain, can cause pain because the pain fibers are upregulated.
All right. Thank you for answering my question.
So what are you going to do now to prevent those headaches?
I'm going to not try to be under pressure. I'm going to relax.
Relax.
Relax. Not trying to stay in a certain position for too long.
Stop overuse. Good ergonomics.
And rotation.
Do your range of motion exercise, and you need to do your strengthening exercise.
Exercise, okay.
Yeah.
If you have any questions that you want us to answer, her or I to answer, write in the comments below.
Yes.
Please, I hope you enjoyed this video.
I hope so too.
I hope we answered your question. Always, please enjoy yourself. Don't get sick. I hope you really enjoyed this video. There are more videos on this channel you can watch. I hope you enjoy those too. Mommy?
Peace and love.
Peace and love.
And relaxation and calmness.